Oh my God. We're at the NTG concert at Red Rocks. It's really them. I love these guys. OMG, it's their top hit song, Dynamite. Ha 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 ha. I'm having a lot of chest pain. Oh God, am I having a heart attack? Or it's probably just my angina acting up. Dang. Wish I had something I could take to help me out. We've already covered some anti-anginal therapies in our Calcium ice cream parlor, where calcium channel blockers slowed the heart and decreased afterload. And at the beta blocker symphony, beta blockers slowed down the heart and decreased its contractility, both of which ended up reducing oxygen demand. Both of these medications have a relatively slow onset, however, so aren't helpful for the acute treatment of symptoms. So we need something that can immediately reduce the oxygen demand of the heart. Enter our next agent, nitroglycerin. Yep, you heard right. Nitroglycerin, the explosive ingredient in dynamite. Nitroglycerin is in the group of drugs called the nitrates, which all work through the same mechanism. We've symbolized this with a fancy dynamite stage prop. And of course, the band is called NTG. Organic nitrates are metabolized in vascular smooth muscle cells and release the gaseous signaling molecule nitric oxide. So we've got our classic nitric oxide exhaust coming up from the dynamite. Nitric oxide activates guanylyl cyclase in the vascular smooth muscle cell, causing an increase in cyclic GMP. Cyclic GMP is symbolized with a grump, so we've got our grumpy band member looking very attractively dark and brooding. Cyclic GMP affects muscle contraction by decreasing intracellular calcium, resulting in reduced activity of the myosin light chain kinase and activating myosin light chain phosphatase. Together, these promote overall dephosphorylation of the myosin light chain, like the falling P battery here, causing relaxation of the smooth muscles. This dephosphorylation of the myosin light chain results in a loss of squeeze in blood vessels, resulting in marked relaxation of veins and increased venous capacitance. Those blue venous pants? So dilated, right? While veins are the most sensitive vessels to the action of nitrates, higher concentrations can result in a modest large artery dilation, and overall this leads to reduction in systemic vascular resistance, so we've mildly dilated his red sleeves too. So remember, dilated veins is the key here. Venodilation and the increased venous capacitance leads to their major effect on cardiac function. Decreased ventricular preload. Just think of this dried up waterfall. It used to have lots of flow, but after the nitrate activity, its preload of water is just dried up. Remember that preload is the load inside the ventricle that the heart has to move. This dried up pond should help you remember that a decrease in cardiac preload, like the dried up waterfall, means decreased cardiac filling, also called the left ventricular end diastolic volume. Less water flowing over the waterfall means the pond just doesn't fill up. This also results in decreased wall stress on the ventricular wall, decreased pulmonary vascular pressure, and overall decreased cardiac output. Afterload, on the other hand, involves peripheral resistance and pressure, what the heart has to pump against. We just said that there is a modest effect of nitrates to reduce systemic vascular resistance, like this falling SVR amplifier, which means that nitrates can mildly reduce afterload as well. Let's return again to one of the main indications for nitrate therapy that we mentioned at the start of this sketch: symptomatic relief in patients with chronic stable angina. So we've brought back our recurring symbol, the anginal anvil. Recall that angina results from an imbalance between oxygen delivery and myocardial oxygen demand, which leads to ischemia and the symptoms of angina. How do the nitrates impact this imbalance? They create an overall decrease in the load that the heart has to move, like we just talked about with preload and the left ventricular end diastolic volume. The less work that the heart has to do, the less it needs oxygen, and our myocardial oxygen requirement is decreased. So get that oxygen tank out of here. Let's talk briefly about the formulations of nitrates used for angina. The liver rapidly metabolizes organic nitrates, thus the oral bioavailability of nitroglycerin is low. This is because of first-pass metabolism, so only a little bit gets through, like only one guy is getting through to backstage. Yeah, he's the type that could afford it, while the rest of the fans have to stay, halted by first-pass metabolism. By administering nitroglycerin sublingually, this first-pass metabolism is avoided, just like that kiddo snuck backstage with those fireworks. Entering directly into the venous system from the oral mucosa, achieving a therapeutic level rapidly and providing immediate relief of angina. He won't be there for very long once security finds him, though, just like sublingual nitroglycerin has a super short duration of action. So, sublingual nitroglycerin is not suitable for maintenance therapy. It's only for acute symptom relief, which you can remember by this band member clutching his heart and gasping for breath. Kind of similar to acute anginal symptoms, huh? Chill, okay? He's not that scary, it's just some fireworks. Oral preparations, on the other hand, have a longer duration of action, so are useful for maintenance therapy to prevent recurrent angina episodes, rather than using nitroglycerin reactively for symptoms when an episode occurs, which is why the maintenance guy here is very relaxed and asymptomatic. These oral preparations include isosorbide dinitrate or isosorbide mononitrate. More important than the names of these oral drugs is the fact that much larger doses of organic nitrate must be administered to ensure sufficient drug levels after that pesky first-pass metabolism. Whoops, that looks like an effect gone wrong. Probably meant to be for the finale. So far, we've been talking about chronic stable angina due to atheromatous obstruction of the coronary arteries. However, another type of angina, called vasospastic angina, formerly Prinzmetal or variant angina, occurs when localized portions of the coronary vessels spasm, causing similar myocardial ischemia and pain as chronic stable angina. This spasm can be reversed by nitrate therapy. Unstable angina and its two meaner older siblings, NSTEMI and STEMI, are grouped together as acute coronary syndrome, or ACS, and they require similar pharmacologic and physical intervention. Nitrates play an important role in the management of ACS, despite no demonstrated mortality benefit, so we've brought in our recurring symbol for myocardial infarction and ACS, the broken heartstring guitar. Specifically, nitrates reduce pain due to myocardial ischemia, improve symptoms of pulmonary congestion, and lower blood pressure in hypertensive patients. But as an important exception, nitrates should be avoided if a right-sided MI is suspected. These patients are dependent on preload to maintain cardiac output, and we already know nitrates reduce preload. So nitrates in a right-sided MI cause more harm than good, which is why this chick is about to smash the right side of her guitar. The fast, powerful vasodilatory effects of IV nitroglycerin and IV nitroprusside are also useful for lowering blood pressure in hypertensive emergencies. And because they relieve preload, are also effective at relieving the symptoms from pulmonary edema from hypertensive emergencies. This brings us to a nitrate we haven't mentioned yet, nitroprusside. Nitroprusside is a bit different from the others, which is why this band member is off the stage, waiting to come on later for his own set. Instead of needing to enter cells to be broken down enzymatically, nitroprusside breaks down within the bloodstream into nitric oxide. This results in a balanced vasodilation, reducing preload and afterload equally. Also check out the sketchy Pharm video on hypertensive emergency for more info on a slew of other drugs with a greater effect on decreasing afterload. Whoa, this crowd is going wild. They're losing their minds for NTG. Finally, let's take a look at the side effects of nitrate therapy. Increased venous capacitance leads to venous blood pooling in the extremities, resulting in orthostatic hypotension and syncope, which also happen to be common symptoms seen at NTG concerts. This hypotension activates baroreceptors, leading to reflex sympathetic activity with tachycardia and an increase in cardiac contractility. Like this raised heart sign should make you think of a raised heart rate. Remember, though, the whole idea of nitrate therapy is to reduce the work of the heart. Increased heart rate and contractility is not what we're looking for. Beta blockers or calcium channel blockers may help reduce this and are commonly co-administered, so we've brought in our recurring symbols for each. Other side effects that result from all this nitrate-induced vasodilation include throbbing headaches and cutaneous flushing, which is why this fan is bright red. His compatriot is bright blue, however, to symbolize that methemoglobinemia is a rare concern, as metabolism of nitrates releases nitrite ions, which react with hemoglobin to change ferrous iron, or Fe2+, to ferric iron, or Fe3+, to form methemoglobin. Methemoglobin has a very low affinity for oxygen and can result in hypoxia, hence the blueness, or even death. Thankfully, it's unlikely to occur with most therapeutic doses. Continuous or daily administration leads to the development of tolerance, resulting in diminished effects in response to successive doses, also called tachyphylaxis. To prevent this, particularly for patients on a regimen of daily long-term nitrates, a nitrate-free interval should be taken every day. This is often timed for night when the patient is asleep and cardiac work is lowest. We've symbolized this with a break area around our maintenance guy, who is our symbol for oral medications, to help you remember that oral nitrates need a break. We'll finish this sketch with a review of contraindications to nitrates. We already covered the contraindication of nitrates in right-sided myocardial infarction, so remember, no smashing instruments at the NTG concert. Whoa. That water balloon is a bit, phallic. Is it really necessary? Looks like security's already on it, though. Sildenafil and other PDE5 inhibitors are vasodilators used in the treatment of erectile dysfunction and pulmonary hypertension. PDE5 inhibitors prevent the degradation of cyclic GMP. If combined with the increased production of cyclic GMP from nitrates, cGMP builds up to massive levels and profound hypotension results. So nitrates are absolutely contraindicated in patients who have taken PDE5 inhibitors within the last 24 hours. For our last contraindication, recall that nitrates reduce preload. For patients with hypertrophic obstructive cardiomyopathy, reduced preload and reduced left ventricular volume worsens their dynamic LV outflow obstruction, so nitrates should be avoided in these patients. So we've brought in our hokum bagpiper. Alright, let's briefly recap this sketch. Nitrates are commonly used for the management of stable angina, among other conditions. Nitrates are metabolized into nitric oxide, which works through cyclic GMP to relax vascular smooth muscle, resulting in marked venodilation, which reduces preload, left ventricular and diastolic volume, and ultimately myocardial oxygen demand, reducing the symptoms of angina. Nitrates also have a modest effect on arterial vasodilation, which lowers systemic vascular resistance. Symptoms can be immediately treated with sublingual nitroglycerin, which bypasses first-pass metabolism and achieves therapeutic levels in seconds. Oral nitrates, on the other hand, take longer to achieve therapeutic levels and are thus best for prophylactic treatment of anticipated angina instead. These also need higher doses due to high first-pass metabolism. Other indications for nitrate therapy include vasospastic angina, as well as acute coronary syndrome and hypertensive emergencies. Most of the adverse effects of nitrates stem from increased venous capacitance and venous pooling of blood, leading to hypotension, syncope, reflex tachycardia, headaches, and flushing, all of which can be treated with beta blockers or calcium channel blockers. Methemoglobinemia is rare but possible with high doses. Patients can also develop tolerance to nitrate therapy, thus a daily nitrate break is required to prevent this. And finally, it's important to mention that nitrates are contraindicated in right-sided MIs, hypertrophic cardiomyopathies, and in patients taking phosphodiesterase inhibitors. Oh, sweet. Looks like I have enough time to grab some of that yummy-looking ice cream before the next set. What flavor should I get? Dino mint? Whoa, hey, watch where you're swinging that water balloon. No one wants to get smacked with that.